Hi everyone, I'm Becky Wilkinson. I am the co-director of the Health Determinants Research Collaboration in Southampton, and I'm going to be joined by my colleague Matt Gummerson from Portsmouth for the second half of this talk. So we thought it would be useful to first explain to you what Health Determinants Research Collaborations are, because they are a new bit of NIHR infrastructure. HDRCs have been established to build a research culture in local authorities in order to use research evidence to make decisions about the wider determinants of health with the ultimate aim of reducing health inequalities. So it's really an attempt to get local authorities to be evidence-based in the same way that the NHS is. So there are now about 30 HDRCs across the country, of which Southampton and Portsmouth are two. So in Southampton, we realised fairly early on that using the term HDRC wasn't very helpful to us. So in collaboration with our communities and other stakeholders in the city, we came up with the strapline, better evidence, better decisions, because we think that really sums up what we want to achieve. So you'll find that I do use that terminology a lot. Okay, so in Southampton, we're a collaboration of the City Council, the University of Southampton, Solent University, and our voluntary sector partner, which is Southampton Voluntary Services. And we have 4 work packages, essentially, that we're trying to carry out, and the first of which is building our research capacity. So we've built a team over our first year of operation, and we are also developing our partnerships across the city and more broadly. So, you know, I recognise a lot of people in the room from that sort of activity. And we're also building the infrastructure within the council for our colleagues. So we've set up an evidence review service to do rapid literature reviews for different teams across the council. And we're also working with partners around our governance and ethics process for local authority. Another work package we have is around changing culture, which is incredibly difficult, but that is what the NIHR have tasked HDRCs with doing. So to change the culture to be that better evidence for better decisions. So to do that, we are trying to actually make changes to the way that decisions are made in the council, just right down to templates that are used and things like that, but also a whole programme of learning and development for our colleagues across the council. The third of our work packages is around evaluation, so that's really supporting colleagues across the council to evaluate all the projects and programmes that we invest in and to learn from that evaluation. And of course to evaluate the HDRC itself, and then to disseminate all that we're learning from that activity. And the one work package that I didn't mention is the public involvement and community engagement, and really because that is the most important one that cross-cuts through our whole programme. So we have really invested a lot of our resource into good quality public involvement and community engagement. There are lots of opportunities for the public to get involved in our work around better evidence and better decisions, right from being involved in the management and governance, and also sort of steering the way that we are operating, getting involved in actual funding bids and being trained up as peer researchers. And a really important way that we're involving the public at this early stage is around priority setting for the HDRC. So just wanted to give you a quick example of that. We recently held our first priority setting event with the inner city community in Southampton. So we were steered by our community partners in the best way to run that event. We had it as a world cafe. We provided activities for children so that families weren't excluded from coming along. We provided a healthy lunch for everyone. And importantly, we went to that community having looked at the insight that had been gathered from that community in the past. Things that they had said in the past were really important issues to them, and we said, is this still relevant? Are these still the things that you really care about that we could try and help you with through getting you involved in that research pathway. So we're analysing all of that information that came out of that event now, and then we will run that through a prioritisation criteria. So we'll look at, is there genuinely an evidence gap around this? Will research help? Is it something that the council can actually get involved in? And then we'll be feeding back to the community and getting them involved in working with us on securing funding bids, training people up to be peer researchers, with the ultimate aim of better evidence for better decisions to reduce health inequalities in Southampton. So I'll pass over now to Matt to tell you a bit about Portsmouth.
So thank you, Becky. So as Becky said, Matt Gummerson, I'm the Director of HDRC Portsmouth. And we're just started, so we got started in January this year, so we're the last of the kind of 30 HDRCs to get going. So really lucky to be building on the work that Becky and colleagues have done in Southampton and that other parts of the HDRC network have already done across the country. And a lot of what we're doing is very similar to the things that Becky's described, so I won't go through all of that. But for me, there's kind of three key elements to what we're trying to do. So we've called it boosting local research. So for us, that's about creating the infrastructure to allow more research to happen around health determinants in the communities that are most impacted by the health inequalities that we know are long-standing issues in Portsmouth and elsewhere. It's about making better decisions. So really trying, as others have said today, we're trying to make that shift towards being a learning organisation where routine use of the best available evidence informs all of the decisions that we make. And we're trying to do that with a kind of focus on what works and why it works for us in our particular context, recognising that the issues that we're trying to address are complex and long-standing issues, and the solutions to those are going to be specific to the areas that we're trying to work in. And the third one, healthier, happier lives, again, really kind of thinking back to Sarah and Alice's talk earlier on. This is about research that comes from our communities, and that will generate new insights and new opportunities for those communities, and that as a result of that will lead to kind of people living longer, healthier, happier lives. You can see on the slide there one of the sessions that we ran, and I think Sandra was at that session. There you go, you can see yourself there. As I say, we're getting going, building our team, building the networks, and one of the ways that we're trying to achieve some of those shifts that we're talking about is what we're calling discovery research. Now I realise there's potential for confusion because discovery research means something else in other parts of the kind of research ecosystem, but for us, discovery research is really kind of those early stages of collaborative projects, so bringing partners together, doing kind of pilot phases of working on research questions together, understanding what the problems we're trying to address are, what the gaps are that research can help us to answer, building connections between community researchers, between academics, between practitioners, and ultimately with the view that will then lead to groups that are ready to bid for funding together. So rather than seeing a funding call come out and then trying to pull a group together, we'll work together on problems, understand what the issues we're trying to address are, and then have those collaborations ready to go. The one that's on the screen there is around early language learning environments. So something that we're interested in exploring in Portsmouth, long-standing kind of issues of low educational attainment in the city. So really kind of trying to get into understanding what drives some of that. And what we've done already is kind of built a cross-sector collaboration. Some of the people that are listed on there are just the people that are involved in that particular project, but we've got community researchers, we've got practitioners, we've got academics working together on that. And what we're trying to do is take an asset-based approach. So we've got our evidence around school readiness data, and we've got anecdotal evidence that the messages aren't getting through to people. But what we're trying to do is work with communities to understand not why aren't they listening to things that we're telling them, but what things are they already doing that are working, and what can we build on with those. And the idea is that will then build into some kind of bigger research projects on the back of that. I do have a short video that I was going to show that's one of our community researchers talking about their involvement in research and why it's been so valuable to them and how it's helped us to kind of ask different questions. I know we're pushed for time, so I'll skip over that. I'll skip over that slide, but the video is embedded in the presentation, so you're welcome to have a look at it afterwards. Some of the other topics that we're interested in are listed up there on the left-hand side of the slide. If you're interested in any of those, then get in touch. But really, at this stage, we're doing that kind of work, building the team, getting into our communities, understanding what are the health inequalities issues that are impacting them, and what are the research questions that will help us make better decisions around how we tackle those. And last slide, just a quick attempt to capture, Ash talked about kind of networks rather than hierarchies before. This is a kind of attempt by me just to capture some of the ways in which, as HDRCs, we're linked into other parts of this system locally and nationally. Apologies to any of you that I've missed off that. I'm sure there'll be some. But as you can see there, we've been really busy, Becky, myself and colleagues, making those links out across the system, ensuring that the HDRCs are part of this kind of network that you're all part of today. And I think what we're trying to get to a position is where we as the HDRCs in Portsmouth and Southampton are your first port of call if you want to engage with the local authorities in our cities, but also if you want to engage with the communities around health determinants research, then we'll be the people that you can come to, as well as being a conduit to other parts of the system. So, as Becky said, we're collaborations with our local universities, we're working with our local voluntary sector, so we'll hopefully be a part of the system that you can come to if you want to do research around health determinants and issues in our communities. And I will stop there.